We have a fair amount of ground to cover today, so please bear with us if you could. Good afternoon. I'm joined by the woman to my right who needs no introduction, the Commissioner of the Department of Health, Judy Persichelli. To her right, another person you know well, the state's epidemiologist, Dr. Christina Tan. Nice to have you both here. The guy to my left who also does not need an introduction, Superintendent of the State Police, Colonel Pat Callahan, Jared Maples from the Office of Homeland Security and Preparedness, and we'll be joined by more of the team here in a few minutes. 2 weeks ago, we put forward a plan for our restart and recovery. It was a plan that would put us on the road back from COVID-19 and toward a prepared, stronger, and more resilient New Jersey. The road back is paved with 5 words: public health creates economic health. We know that for our economic restart to turn into a full-fledged recovery, we need to give working New Jerseyans and business owners confidence that we are ready to move forward. We need to give them confidence that we are prepared and that we are moving responsibly and purposefully. As I said, we will move as quickly as we can, but as safely as we must. Getting New Jersey on the road back begins by reaching benchmarks and data milestones, most notably within our healthcare sector, where the numbers are concrete and we can see in the numbers of real people the impacts of our policies are having. Over the past 2 weeks, and in some cases longer, we have seen the trend lines that we've needed to see. These metrics are the key indicators we monitor as we continue down the road back. These data points not only give us our clearest and most accurate point-in-time pictures, but the trend lines they form inform our progress to break the back of the virus. Positive test results and the number of blessed lives lost that we report every day are clearly important. However, the former, in other words, the test results, is impacted by how many tests we receive on any given day, and the latter, the fatalities, is as deeply saddening as that is, are lagging indicators. People sick enough to have to enter a hospital, and the people in a hospital, especially loved ones requiring an ICU bed or a ventilator, these are hard, here and now data points. Because of your incredible work, and we're going to stay on the slide for a minute or two here, because of your incredible work over the past 2 months, you have moved the trend lines in the right direction. You have saved lives, each and every one of you out there, and your sacrifice has saved new hospitalizations and lives. As you can see, new hospitalizations are down 70% from the peak. Total hospitalizations are down nearly half since the peak. The number of patients in ICU and on ventilators are both down significantly. The numbers of new cases are down 60%, and the deaths, thank God, have decreased by more than 1/4 from the peak. The multiple stresses on our state have been consistently, and in some cases dramatically, lessening. So stay with this for a second. What I'm saying, I want to make sure everyone understands this. The top 4, and Judy will, I think, be in violent agreement with me on this. The top 4 lines are hard numbers. We know the new hospitalizations. We know how many are in a hospital, how many are in ICU, and how many are on ventilators as of 10 p.m. every single night. Judy gets that report, and we report it out to you. New positive cases, as we've said, represents clearly combinations of some amount of community spread, but overwhelmingly the fact that we've ramped up testing dramatically over the past 2 months. And deaths, as sad and tragic as they are a lagging indicator. These are folks, Judy or Christina, who have been infected maybe 3-4 weeks ago. And then never mind the lag we may have in getting proper cause of death, death certificate, etc. But if you look at the right 2 columns, the progress is undeniable, both from peak and since only a couple of weeks ago. And by the way, all this data is as of yesterday, May 11th. And so I want to again give a shout out to everybody out there. This does not happen without the efforts of everybody in this state doing an extraordinary job of staying home and staying away from each other, wearing face coverings, washing your hands with soap and water. It is a huge success story. I normally, with our kids, when I hear I've got good news and bad news, I normally ask them, make them, I guess, give us the bad news first. I've just given you a lot of really good news. Now I'm going to give you some sobering news. Let's flip this over. We must remember that we are not out of the woods yet. Looking at the numbers of COVID-19 cases, hospitalizations, and deaths per 100,000 New Jerseyans, we can make a strong case that no state is currently impacted as ours. There are still thousands in our hospitals. Let's go back to that if you could. Thousands in our hospitals, and sadly an untold number more will perish. We know this, and we cannot forget this. So just as I sat on the good news, I'm going to sit on the bad news, and I hope you all can see that. New cases per 100,000, we lead the nation, and this is as of yesterday. Patients in hospitals per 100,000, we lead the nation. New deaths per 100,000, we lead the nation. So to all those who say willy-nilly, the Nostradamuses out there who think they can predict the future and that we can open this place up wide and be carefree and get back to some semblance of where we were a couple of months ago, I want you to commit that chart to memory. We will take steps. We will take them responsibly. You're going to even hear about some steps that we'll take this week. But those numbers don't lie. We are still the most impacted state in America. Remember, we're the densest state in America to begin with. And that's a big reason why we're dealing with this at the intensity level that we are. We reopened our parks 10 days ago because the good signs we saw in the data meant that we could put our trust in you all to do the right things, to keep things moving in the right direction. As I've said, data determines dates. Reopening our parks was one example of this in action. And again, notwithstanding some aberrant behavior, overwhelmingly, folks have done the right thing. We want to see you wear more of these, right, Judy? More face coverings. But overwhelmingly, you've done the right things, and you continue to do the right things. The point is, we're not out of the woods yet. So now, we are putting our trust in you yet again to help us as we begin to get farther on that road back. No one should stop your social distancing. In fact, as we safely begin to reopen, it will be perhaps even more important. Throughout these past 2 weeks, we have been focused not just on the data we need to get on the road back, but just as importantly, we've been focused on meeting the other principles necessary for us to stay on the road back. And today, we're going to discuss two of those in greater detail: testing and contact tracing. First, on testing. We are now well on our way to our next goal of being able to provide at least 20,000 tests a day by the end of this month, and to continue building out that capacity as we go forward. Our teammate Dan Bryan in the back describes it as a floor, not a ceiling. I think that's a good way to put it. More testing means more people will know their health status, and that means more peace of mind. And more testing creates more data, and more data allows us to take more steps forward. To be clear, when I said we wanted to double our daily testing capacity, I wasn't setting, as I just said, a ceiling. I was drawing the line that will be our new floor. In March, you could see we were at the end of March at 6,000 tests a day.